Hello students, today we are going to talk about Mycobacterium leprae, a very precise topic. I'm not going to take much time. You must have heard this term before, Mycobacterium leprae. Remember Zn staining. While we were talking about Zn staining, we had a part called modifications of Zn staining, wherein we have already studied 20% H2SO4 is usually used as a decolorizing agent. But in case of Mycobacterium leprae, it being an exception, we use 5% of sulphuric acid as a decolorizer. So let's get to know about it a bit more in details. To begin with, let's talk about the general properties of it. It's a very notorious organism, let me tell you. It is intracellular, obligate aero, and moreover, you cannot make it grow in any way you feel like. In artificial culture media, in tissue culture, no, they will never grow. So where to make them grow? There is an organism, or rather an animal, named as 9-banded armadillo, or we can also make it grow in the foot pad of mice. Now how to do it? We are just going to inoculate the leprae bacilli into them, and we are going to observe the infection that it manifests. How we can see it? Usually in both Lepromatous Leprosy bacilli, usually this particular organism, it will show Lepromatous leprosy in both the animals, in the foot pad of mice and also in the 9-banded armadillo. Now, talking about its feature, how it looks like, usually it's forming a cigar-like bundle. What does it mean, cigar-like bundle? Means cigar, you must be aware of this word, a bundle of it. When you clump them all together, when you stain it through acid-fast stain of a skin lesion, you will see that cigar, when it is bundled up, clumped up together, it forms that kind of a structure. And moreover, it's like a cigar-like bundle on a lipid-laden macrophages, which is usually termed as virtuose lepra cells. As you can see in the presentation, the chronic granulomatous disease, which is usually termed as leprosy. So in the right hand side, a cute old lady, you can see the facial features of that particular lady, and on the left hand side image, you can see it prominently, the chronic granulomatous lesions. Moving on to the classifications of leprosy. On the basis of the clinical, bacteriological, immunological and histological status of an individual, we can broadly classify into 5 types. Number 1, LL means Lepromatous leprosy. Number 2, Tuberculoid leprosy. Though it is shortened out as TT, it's not table tennis, it's Tuberculoid leprosy. The third one being borderline type. Fourth is indeterminate, and the last one is pure neuritic. So as you can see in the figure, the nose has been pricked out. There must be some story behind it. So let's get to know it in details. The first one is Lepromatous leprosy. This is called as multibacillary. Why is it so? Multibacillary. Multi means there is more number of bacilli present. So in the macrophages, you will find large clumps of bacilli in it. Moreover, the skin lesion that it manifests, what is the characteristic feature of this kind of skin lesions? You will find them, number 1, symmetrical. Number 2, the margins are irregular. See? Irregular margins, I'll show you in the figure. Moreover, there is a terminology named as leonine facies. How it looks like, we'll show you. And besides being its skin lesions being formed, the CMI means cell-mediated immunity, it is impaired. And since it is impaired, a test named as lepromin test, which is largely dependent on the cell-mediated immunity, it is negative. Alright, so this particular skin lesions, we can find them, it invades through nasal mucosa. Somebody who is having leprosy, it will have the tendency to be passed on to the other person through nasal mucosa. Remember who is now ruling over in that particular passage? Okay, let's talk about it some other day. You can see this particular figure that you can see the A side, it is known as leonine facies. You can see it on the face, it's a skin lesion. Okay, and moreover, what were the other terms we studied? We studied it is symmetrical and irregular margins. So you see, if you divide the person's face into two equal halves, the lesions, the skin lesions will be symmetrical. Alright, so that was about the Lepromatous LL. Moving on to the TT, no, not table tennis, it's tuberculoid leprosy. It is called paucibacillary. Paucibacillary means, pauci means less in number. So the load of bacilli is less in this case. Moreover, the lesions, it is a little bit different from the previous one. The previous one was symmetrical, this one is asymmetrical. And the margin of the lesion is sharply demarcated. What was about the previous one, LL? It was finely, you can demarcate it properly, sharply defined. No, in this case it is tuberculoid leprosy, in this case it's sharply defined, but in case of LL it was not, it was irregular. Okay, moreover, besides we also have got anesthetic patches, which obviously by seeing you cannot understand, you have to make that person say that particular lesion is anesthetic to that person cannot sense that particular lesion once you touch it. You have to make that person close his eye and you have to touch at the particular lesion and ask that person, can you sense it? Can you feel the cold or heat? Okay, CMI is adequate and lepromin test is positive, and I have already said that lepromin test, I'll tell you about it in later half. It being largely dependent upon the cell-mediated immunity, lepromin test is positive. It is least infectious, so somebody has to be more infectious. Yes, the previous one, Lepromatous leprosy, the load of the bacilli being so immense, it is highly infectious. You can see the lesion, the margins, sharply defined, and it is anesthetic patches that you can see, asymmetrical as well. Alright. That was the two type. The third one is borderline type. Borderline means somewhere in between. Neither ka, neither ka. So tuberculoid and lepromatous. It's a combination of both. It can have the tendency to move on to TT or LL depending upon either of the two things, either the chemotherapy or the alteration in the host's resistance. Next, indeterminate, and the last one is pure neuritic. Indeterminate means it has not yet decided to which side it will go to. Is it TT or LL? Tuberculoid or lepromatous? It has not yet decided. So it's a very early unstable case that you can see there will be definitely a sensory impairment in that person. Bacteriologically, you will not find any leprae bacilli in there. Pure neuritic, by the word itself we can understand there must be a neurological manifestation in here. Okay, so here is a table of difference: tuberculoid, borderline and lepromatous. First one, leprobacilli in the tissue. In the very first part, what did I say? I said ki lepromatous leprosy, in that case there is a huge load of bacilli. So obviously you can see there are 3 pluses in there. But in case of tuberculoid, they may be or may not be present. The bacilli may or may not be present. Borderline, since it is in between lepromatous and TT, it has the presence of leprobacilli but not to that extent which resembles lepromatous. Okay, the second point, lepromin test, already said lepromatous, it is negative, CMI having not much involvement in here, and tuberculoid, it is plus plus. Third point, mycobacterial antibodies, jekhane antigen is excess, obviously the antibodies load will be more. So lepromatous, we have more leprae bacilli, so obviously antibodies will also be more. Okay, fourth one is lymphocytic infiltration of lesions. In case of lepromatous leprosy, you will not find it, but it will be immense in case of tuberculoid leprosy. Moving on to the immune response. We have already used the term CMI, cell-mediated immunity. We have also acquainted ourselves in which case it is more, in which case it is affecting. Now let's get a little more details about it. Innate immunity in case of leprosy, you can observe it in high degree, but humoral antibodies will not have much role in it. Why is it so? In the very beginning, when we talked about general properties, I have already told you leprobacilli is intracellular, means it resides within the cell. So if it doesn't come out of the cell, how will you find the antibodies being formed? So it's very obvious. Besides CMI, there are certain categories which are being made on the basis of the cell-mediated immunity status of the person. Let's get to know that. We have classified into 2 types. First group, somebody who is having low CMI. The second group whose CMI is, chalo, theek hai, okay, fine. The one who has got low CMI, they have the tendency to go for the LL type, Lepromatous leprosy type. What happens in that case? In such patients, you will find the delayed type hypersensitivity being absent. So since this is absent, obviously Lepramin test, since I told you in the very beginning, cell-mediated immunity has got a very important role in Lepramin test. So obviously the Lepramin test in this case will be negative. So DTH absent, Lepramin test negative. Why? Because CMI is not having any role in here. We are talking about LL. Okay, remember Virchow's lepracell, lipid-laden macrophage within which we have got the Leprabacilli? Yes, the cigar-like bundles, Virchow's lepracell will be abundant in this case. Besides, LL patients are not much susceptible to opportunistic infection. Why? Because it's very antigenic specific manifestation that it shows. Moreover, CD4-CD8 ratio is reversed. In usual case, CD4 is to CD8 is 2 is to 1, but in case of LL type it becomes reversed, mane 1 is to 2. They show predominant TH2. TH2, remember T cells, TH cells, TC cells. So TH cell, for that it has the manifestation of TH2 cycle. So TH2, what it is mainly responsible for? Remember, antibody expression. So if you have the TH2 response being predominant, obviously antibody expression will also be predominant. Why? Because there are some interleukins who are doing the main role. Kiki, interleukin 4, 5, 6 and 10. Mainly these 4 interleukins will do the main role. And humoral immune response, I have already told you, there will be polyclonal B cell activation. Okay, now the second group, people with intact CMI, their cell-mediated immunity is not impaired. In that case, they have the TT type, meaning tuberculoid leprosy type. Here, the reverse happens, meaning DTH. There you can observe the delayed type hypersensitivity, and as a result of which Lepramin test is positive. Previous one, it was predominant TH2 response. For that, exaggerated antibody production. In this case, TH1 response is predominant. TT, TH1. TT, TH1 response being predominant, you will find macrophages being activated. So, classify this into 2 different groups. Here, CD4-CD8 ratio is normal, that is 2 is to 1. Now, what complications can it cause? There can be deformities. What deformities can it have? Nerve injury, there will be muscle weakness and paralysis. Facial deformities, remember the leonine Fishian's face I have shown you? That is a deformity that will show. Moreover, there will be loss of eyebrow and loss of eyelashes, and there will also be infection or injury. See the first one, face, leonine facies. You can see the figure, see the face of the person. They have got the sagging face. Eyebrow lost, eyelashes lost, nakta, chapta, saddle nose. See the hand, clawed, see the hand, the fingers, it's clawed, and moreover wrist is being dropped. See the feet, do you see the toes? They have been clawed, just like they have been cut off, chucked off, like that. Alright, so next thing is lepra reaction. There are different manifestations that it shows. There can be 2 different manifestations which is exhibited by lepra reaction. Number 1, lepra reaction type 1, which is also known as reversal reaction. The second one is lepra reaction type 2, which is also known as erythema nodosum leprosum. What is it all about? What is this lepra reaction? Okay, somebody who is having leprosy, that person is being given the treatment. Now, always that person will be recovering from that particular disease. It doesn't happen to be so. There can be side effects, and that side effect is what is lepra reaction. The first difference, in case of lepra reaction, the hypersensitivity is DTH, meaning type 4 hypersensitivity. But in case of lepra reaction 2, which is also known as erythema nodosum leprosum, it is type 3. Type 3 ta ki hobe? Immune complex mediated. Okay. So usually who are in the borderline leprosy means they have not yet decided to which side they will go, either LL or TT. For in that case, lepra reaction type 1 happens. Either it will happen spontaneously, meaning immediately once you give the chemotherapy, in that case it can happen, or maybe after that. Okay. The second one, lepra reaction type 2, for that, in such cases, lepromatous variety, meaning LL or BL, meaning borderline. Both cases can happen. So, reaction 1, it is only borderline. Reaction 2, it is borderline or LL, either of the two. Achha. Manifestation, as you can see, inflammation of the previous lesion. Meaning there was a lesion before, and their inflammation has happened in the previous lesion. Meaning jekhane already lesion was present. Okay. In case of lepra reaction type 2, there will be as we said, erythema nodosum, so there will be crops of painful erythematous papule. Okay, what it progresses as, I told you, chemotherapy. So either it will be when the chemotherapy is being given or maybe after that. So when the chemotherapy is being given, it will have the tendency to move towards LL type, or maybe if after the treatment it happens, it will have the tendency to go towards TT. Okay, so going for the lepra reaction type 2, it is usually after. There is no question of before or after in type 2. Okay, TH1 and TH2 is predominant. TH1 in case of lepra reaction type 1 and TH2 for lepra reaction type 2. Okay, epidemiology. How it spreads, where it manifests. Number 1, multibacillary. Already I have told you what is multibacillary all about. So leprosy tends to be multibacillary. Tends to be. Usually what it happens. Besides nasal droplet infection and other environmental factors that can influence our people of rural area, moist soil, humidity and blah blah blah, all that stuffs. Okay, so what kind of specimens can come to you for lab diagnosis, or rather what kind of specimens will you ask for? There can be 3 kinds of specimen. Number 1, skin smear. Number 2, earlobe smear, and number 3 is nasal smear. So a skin smear, which is famously known as slit skin smear. How do you know? How do you proceed with this particular specimen? Let's get to know it. So the first one, slit skin smear. You obtain this from the edge of the lesion. First of all, you have to make it sterile. How do you make it sterile? Alcohol. Using alcohol, you make it sterile, wipe it off with a cotton and make it sterile. After that, you take a scalpel and again sterile it. How do you sterile a scalpel? Yes, you pass it over the flame. And then you make an incision in the lesion. You make an incision of roughly around 5 mm. Long incision is made with the help of a scalpel. And you have to go, not like making an incision and pouring through the lesion, not like that. You just have to go up to the infiltrated layers. Okay, deep enough to reach up to the infiltrated layers. Then obviously some blood and lymph will be coming off. You have to just wipe it off. You don't need that blood or lymph. What was the sample? Slit skin smear. So obviously you need skin, you need the tissue. Alright, so you turn the scalpel transversely. You don't need the sharp end right now, you need the blunt end because you have to take off this tissue. So you take the blunt end and then with the incision that you have made from the base of it, you collect the tissue. With the help of the blunt end of the scalpel, you collect the tissue and put it onto the slide. Of course, slide has to be cleaned. So you put it onto the slide and maybe roughly around 8 mm diameter smear that you are going to prepare and proceed for Zn stain. Obviously, Zn stain. Okay, I'm going to show you a video how this slit skin smear is collected. Okay, I presume that the patient's earlobe has been steriled using alcohol. You have to pinch off tightly. You know why? Because you have to reduce the supply of blood from there. So you pinch off tightly. You see how tightly the person is pinching off the earlobe? Yes. So you pinch off very tightly, and in the meantime, you have to pass the scalpel over the flame. What for? Obviously, you have to make the scalpel sterile, and there you go. You make an incision. What is the size of the incision? 5 mm. Just reach the infiltrated layer. You see, I don't know how far you can see it. It's evident, the incision, how it has been made. And after the incision has been made, you can see some liquids, rather lymph, or no blood you can see here. Lymph is coming off, although not much precise. I could find only this video, can't tell. Okay, so this lymph that is coming off, don't need, so discard it. He is consistently pressing there. Pinching off is not possible to let go. So now he is going to collect the tissue pulp through the other side of the scalp. You see the blunt end? With the blunt end he is collecting the tissue, collecting it, and oh, it goes dark. No, it doesn't go dark. Some issues with the camera. Okay, so he puts it on the slide and makes a smear. Okay, so 8 mm diameter of the smear that has to be made. he repeats it, because just taking one sample won't be sufficient enough. Leprabacilli might just not be present in the single smear, so you have to take a repeated sample, you have to make repeated smear, you know. There are usually 7 sites which are ideally taken, 7 sites. Earlobe, from the eyebrow, from your nose, from the lesion site, which can be anywhere in your body, from there. So 7 sites, 6 to 7 ideally, sites are chosen, and the similar way the samples should be taken. So let's go back to our presentation. Alright, so that was all about the slit skin smear. Next is nasal specimen. Subah uthao, usko bolo ki naak dho. So early morning specimen that we will take, the early morning mucus is collected from obviously the nose, and make the person blow his nose and collect the shordi. Next is nasal scraping. Nasal scraping is done exactly in the same way how you take the slit skin smear, just you do it in the nasal septum. The person will have the tendency to sneeze right on your face, but you just have to be very careful. Okay. Next is nerve biopsy. In case of leprosy, they have the nerves are usually thickened. So we can collect the nerve biopsy from the thickened nerve and then submit it for the histopath examination. Okay, we are not concerned about that. Let's get into the microbiology part. So microscopy, obviously I told you we do the Zn staining using 5% H2SO4 as decolorizer. So you can see the Leprabacilli, I don't know how far you can see. Yes, there you go. You see the bundle, cigar shaped bundle as you see. Number of cigar collected together, clumped together. And where is it clumped together? Lipid laden macrophages. You clump it together and you see the Zn staining being performed. So it's red acid fast bacilli being arranged singly or in groups. Cigar-like bacilli. Remember the word. It's specifically it's used for leprae. Alright? Cigar-like bundles. Going on to the grading. You remember the grading for Mycobacterium tuberculosis? 1+, 2+, 3+, scanty and all that. Same thing here. 1+ theke, 6+ obdi. What is the grading? 1 to 10 bacilli, 100 oil immersion field, 1+, 1 to 10 for in 10 OIF mane oil immersion field, 2+, 3+, 4+, and last you see the 6+1 greater than 1000 bacilli. Mane they are all in clumps. In every single field you find the clumps, mane greater than 1000 bacilli, then you grade it as 6+. 3 terms are required. Once you are done with grading, 3 terms are required which you have to enumerate. Number 1, bacteriological index. Bacteriological index means you sum up the pluses that you have got. You have observed the smears. Suppose you have observed the smears for up to 5 smears you have seen and you have summed it up. After getting the signing or grading of individual smears, you add them up. Suppose you have taken 5 smears. In the first smear, you have given it 2+. In the second smear, you have given, smear means different glass slides you have taken and different smears you have taken. Okay. So first one you have given 2+, second one you have given 3+, third one you have given say again 2+, this way you go on. So the number of smears that you have observed is 5. The plus thing that you have seen, you add them up. So that addition divided by number of smear will give you the BI, bacteriological index. Means total number of bacilli, irrespective of being live or dead, seen per OIF. Okay. Next one, morphological index, MI, means the bacilli which has been perfectly stained. The perfectly stained bacilli, you count them out and divided by the number of bacilli, whether it is perfectly stained or not, the percentage that you get is your MI, morphological index. The last word is solid fragmented granular bacilli percentage, means their staining has to be definitely perfect and their structure will also has to be definitely perfect. Absolutely perfect bacilli you can find and you have to record that, and that's what gives you the SFGB percentage. Alright, about the culture I have already told you, mouse food pad inoculation. You can intradermally inoculate into the mouse food pad and you observe for the infection. There will be tremendous infection that the particular mouse will exhibit, and after say around 6 to 9 months, you will find that particular mice, the food pad specifically, you can see that there is Lepromatous leprosy seen. Armadillo, 9-banded armadillo, they are highly infectious. They are highly susceptible to leprabacilli. So once you inject into them, once you inoculate leprabacilli into armadillo, they will start to show the manifestation of lepromatous leprosy within a couple of days. Serologically also you can go for it, FLA-ABS, fluorescent leprosy antibody absorption test, to identify specific antibodies, and of course ELISA. So let's get back to lepromin test. Lepromin test, how it is performed. You take lepromin antigen, roughly around 0.1 ml. You take the lepromin antigen, roughly around 0.1 ml, and you inject it intradermally. How did you prepare that lepromin antigen? You prepared this lepromin antigen by culturing it on, say for example, armadillo or food pad of mice. You extract that particular antigen, you inject intradermally 0.1 ml of that particular antigen, and you observe the reaction. The reading is taken 2 times, once after 48 hours and again after 21 days. The one which you observe after 48 hours, it is the early reaction. The one which you observe after 21 days, it is late reaction. Early reaction is called Fernandez reaction, where you will find induration surrounded by erythema. There will be induration. You know, you are well aware of what induration is, and erythema means the surrounding will be red. After 48 hours you are going to find it. This will indicate DTH, and this thing, induration surrounded by erythema, will last for up to 3 to 5 days. And if you find that particular red area greater than 10 mm, then you call it positive. Going for the late reaction, which is also known as Mitsuda, it's indurated skin nodule. You can see indurated skin nodule. The reading is taken after 21 days, and if the lesion is greater than 5 mm, then it is positive. Treatment: dapsone, rifampicin and clofazimine is usually recommended. Prophylaxis: BCG vaccine, you are all aware of it. So BCG vaccine is given. Moreover, BCG vaccine with some killed lepra bacilli is under trial. It's still going on. MIP vaccine, which has been developed in India, in 2018, using M. indicus prani, which used killed leprosy vaccine. Leprosy elimination is a campaign which is being promoted by WHO, where less than 1 case per 10,000 population in India is what they aim for. Besides, there are other institutions, National Jalma Institute and CLTRI in Tamil Nadu. They also promote in eliminating leprosy. So that was all about Mycobacterium leprae. We will proceed with the assignment attached to it, so it will be provided to you separately. Thank you.